It's now 6 o'clock, and I'm handing over to the CEO of SAMA, Dr. Nodikida. Thank you, Dr. Nodikida.
Good evening, colleagues, and thank you very much for making the time and join us this evening on our webinar. My role is very brief here. I'm going to be a program director for tonight. Just the outline of the webinar. So firstly, we will be welcomed by Dr. Hussein. Dr. Hussein is the chairperson of the Employed Doctors Committee within SAMA. We'll then hear from the chairperson of the association, Dr. Mvuyisi Mzukwa, and then we will talk about the history, the role, and the structure, including the benefits of being a member of JUDASA from the ex-chairperson of JUDASA, Dr. Tsepile Tlali. And then we will talk to the reactivation of JUDASA and branching out to provinces, and that will be covered by Dr. Ruhan Botha. We then after that deal with the governance issues that relate with JUDASA being a committee of the South African Medical Association, and the company secretary of the South African Medical Association, Ms. Carpenter, will then take you through. And after that, we'll then deal with the Q&A session. And we are looking forward to a very interactive session with yourselves. Thank you very much. Let me then hand over to the chair of the Employed Doctors Committee, Dr. Akhtar Hussain. Thank you very much.
Good afternoon. Thank you very much, Program Director, Dr. Theo Nodikita, CEO of the South African Medical Association, who himself was a JUDASA leader. And I like, on behalf of South African Medical Association, a warm welcome to the SAMA board members, junior doctors, and other distinguished healthcare workers attending, and the professional. Thank you very much for joining us. I will be very short in the briefing history here. For me, an Employed Doctors Committee feel that without JUDASA, we are incomplete in public healthcare sector. Today is the 20th March 2024, is a historical day for Junior Doctors Committee. We used to call junior doctors as a young lion doctor's voice. We, as a SAMA leadership, have been working very, very hard for internship placement, for community service placement, and also post-com doctors, medical officer grade 1 posts. We have joined webinar 2023 with National Department of Health and ICSP for how to apply internship and community service, where we engage National Department of Health of DDG, Human Resource, and the DG. And we have been very successful on that webinar. The internship and community service post were more, they joined more than 1,500 students of the final year was participating on that webinar, and National Department of Health and SAMA managed to place every South African citizen graduated from South African Medical School 2024. So this is the first time we had a joint webinar with Department of Health for internship placement, and that is one of the big achievements. And going forward, 2024, we will do this again, same joint venture for the placement, maybe mid of this year. Every year, we welcome our new doctors for orientation program throughout the country, in the provinces and all the big hospitals. We provide the guidance and provide resources to the interns, especially intern book 101 and now 102 booklet, which provide everything what intern need to start their first day at work. Also, we provide legal advisory and the labor relation issues. HPCS has challenges, registration issues, any workplace dispute or labor matters, or any conflict at workplace, we resolve as soon as possible In public health sector, our legal and labor team never lost any cases. We are establishing our relationship with the bargaining council, and we will have very soon MOI with them. And thank you so much. Then SAMA has as a SAMA, we had our right to represent our fellow membership or fellow colleagues, and it's our constitutional right. You, as a junior doctor, you are our future leader, and you going to be SAMA ambassador. We will have soon each and every hospital a committee and our ambassador for a bigger and strongest voice for doctors. Let's join hand with one mission of quality health care and bringing back doctors' dignity and respect for the patient as well in our society, in our community. Thank you very much. The program director, I will hand over to you for our keynote speaker, our own chairman, South African Medical Association, for Dr. Muzuka. Thank you.
Oh, thank you. Thank you very much, Dr. Hussein. And over to you, the chairperson of the association, Dr. Muzuka.
Thank you very much, Dr. Notgid, and thanks to Dr. Hussein for his valuable input. I'm not sure if I'm audible enough, the program director.
You are loud and clear, Chairperson.
Thank you very much. Good evening, colleagues. On behalf of the South African Medical Association, I would like to extend this warm welcome to the SAMA board members who are part of this call. And also, I would like to extend our warm welcome to the junior colleagues and other distinguished healthcare professionals. And really thank you for joining us in this call. We're really excited to formally announce the rebirth of the South African Medical Association member-driven committee, known as JUDASA, or Junior Doctors Association of South Africa, in this forum. The goal of this campaign is to promote junior doctors' rights and welfare throughout South Africa. The goal of this committee is to take a proactive measures to address the issues at hand, rather than just drawing attention to them. It is about creating an environment in our healthcare system where junior physicians feel appreciated, respected, and given the assistance to carry out their essential tasks. It is important to estimate the importance of, it is impossible to estimate the importance of junior doctors in our healthcare system. As you all know, they are the foundation of our clinics, our hospitals, put in endless hours on the front lines to deliver vital healthcare to our communities. However, in spite of their vital function, younger physicians frequently encounter a great deal of difficulty and adversity throughout their career. They face a wide range of difficulties, from long hours and severe workloads to insufficient resources and support networks. These challenges have a significant impact on patient care and safety, in addition to the well-being of our healthcare workers. Now, junior doctors' voice will be amplified through JUDASA, ensuring that their needs and concerns are taken seriously. In order to bring about significant change, we want to promote cooperation and communication amongst healthcare stakeholders. Perhaps most of all, through JUDASA. Though we think JUDASA is about unity, it is also about putting up a united front and realizing that the problem, that the problems that the junior doctors are facing or confront are really systemic problems that call for a group effort, to solve rather than, deal with issues individually. I now want to give a brief introduction to Dr. Tsepile Ntladi, the chairperson of JUDASA. Over to you, Dr. Tsepile.
Good evening, colleagues. Thank you so much, Dr. Mzukwa. Dr. Notikita, please confirm if you can hear and see me.
Yeah, we can hear clear
We
loud.
can hear you.
Thank you. So my name is Dr. Tsepile Ntladi. I have had the privilege of serving in JUDASA from my first year of internship, serving in the Eastern Cape, forming a committee in the Eastern Cape, and then going forward to being part of the national committee, and then later being the chairperson of JUDASA. Unfortunately, I have the the honor of being the longest serving JUDASA chairperson, who is now also a South African Registrars Association vice chairperson, due to challenges that we've had in the past. So before Sama and Samatu splitted, the JUDASA had a system. What we had a proper turnover every year when we'd have new members in the committee. And unfortunately, because of the split, we then unfortunately went dormant. And because of this, it really placed strain on Junior Doctors Association and our ability to address the challenges that are faced by junior doctors every day. And part of the reason why that is difficult is because the current sitting committee in JUDASA, most of which are no longer, I think all of them are no longer junior doctors. So we're very excited to be reviving. I'm very excited that JUDASA will be revived and we'll be able to continue our fight in improving conditions for junior doctors in South Africa. In our time serving in the Junior Doctors Association, we've faced a lot of challenges and we've dealt with a lot of challenges that have been thrown in our way. The most difficult one, or the one that's been the most prominent that we've had, has been the issue of placements of junior doctors. That is a challenge that has taken up a lot of our time in the past. And we have made a lot of strides in the years with regards to creating a relationship with the Department of Health and the ICSP in order to improve the placement of interns and community service doctors. So I'm very proud to say that in as much as the challenges are still there, there's a route to helping alleviate this problem. Other challenges that we've had to deal with are issues of poor working environment, be it unsafe or lacking supervision or resource limitations. And also we've also had to deal with issues such as working hours, unsafe working hours. I'm also very proud to say that we also were in the process and started advocacy for mental health. As we know that doctors are amongst the highest prevalence of sufferers when it comes to mental health. And we very much strongly found that as a pillar that we want to address and help and create space for junior doctors to feel free to talk about the challenges that they're facing. Speaking to the junior doctors in the attendees, those specifically who will not be serving on the committee, I would like to really encourage you to really take advantage of JUDASA. From our time, we found that there was a lot of shyness from our colleagues because they perhaps felt that they'd be overstepping if they wanted to be involved in a deeper level of JUDASA, which is quite false. We are very much welcoming to anybody who wants to be a part of JUDASA. So I just want to encourage you, if there's anything, any creative ideas that you want to bring up. In the past, we've had people who wanted to start fun runs or sporting events. So if you have any fun ideas such as that, you're more than welcome to approach us. And another thing is that I also want to encourage junior doctors to really find out about the branch councils in their regions. Those are the pillar that assist us as junior doctors and doctors beyond that to be able to address the local issues that are affecting us in our workspace. And speaking to the incoming committee, please know that in as much as this responsibility that you've taken up upon yourself is humbling and might feel overwhelming, it is one that is a privilege, one that will have ups and downs, one that will make you want to cry. But at the end of it all, it'll all be worth it. I'm very happy that we've got an incoming team, and I really believe in you. Me and my outgoing team will be here for you guys. We know your challenges, and we are here to offer you support, and you can call us anytime you need. I'd like to also encourage you also to be a very big part of your branch council, so you can also be introduced to the institutional structure of the association and how you can further involve yourself going forward. I thank you.
Thank you very much, Dr. Sapile. And then we hand over to Dr. Porter. Over to you, Dr. Porter.
Okay, thank you very much. I'm just going to share my screen quickly. Okay, can I just confirm that you can see my screen and hear me as well?
We can see it, thank you.
Loud and clear.
Okay, thank you. Good evening, colleagues. I'm Rohan Botha. I'm currently, let me start by just sharing a bit about myself. So I'm the incoming chairperson for JUDASA for the new term. I grew up in Pretoria, then studied in the Western Cape at Stellenbosch, then did my internship in the Eastern Cape, and then now doing my community service in Nelspruit. I think most of the junior doctors will know me probably from our community service placements from last year, where I became a bit of a voice with our struggles, where I got into contact with the ICSP and tried to communicate as much as we can. And then after that, I decided to make contact with SAMA and that had started the talks to start reviving the Junior Doctors Association. And that's why we're here today. As you can see, I've been quite a bit across South Africa, not everywhere yet. And even though I've been at all these places and have a bit of background and understanding for how the different health systems function, I won't be able to take on all these challenges by myself. And therefore, it gives me also great pleasure to introduce the new JUDASA committee. So it's myself as chairperson, and then Shadai Breed as the vice chairperson. Then we have Esmerie Koch, who's a community service doctor in Kimberley. Farina Abdullah, also a community service doctor in Middelburg. Janke Metz, community service in Bloemfontein. Maki Kaseke, who is a second-year intern in Johannesburg. Then we have Jessica Davies, who is a first-year intern working in East London, Simon Fraser from the Northwest. We have Vudi Ravutse, who is in Limpopo as a first-year intern. Then we have Simon Fraser, as I mentioned as well, sorry. Then Dr. Michaela Singh, a first-year intern in the Western Cape at Grote Schuur. And then Dr. Tumisang Malete, we're very excited to have joined us from the KwaZulu-Natal, who is already a medical officer. So as you can see, looking at this committee, we have quite a wide range of doctors ranging from first-year interns all the way to medical officers to try and be as representative of all the junior doctors in the country. So our goals for the year, I think our primary goal for 2024 would be to set out the structures for JUDASA to function well, and then to consolidate a good foundation so that we can build on this for years to come and have a strong, thriving JUDASA. Then what we want to address as other goals as well is intern and community service placements to improve the system and improve the collaboration with the Department of Health so that the system can be more fluent and less troublesome. But then also with this to address the problems that interns and community service doctors face during their training, such as a lack of supervision and too many hours and any other problems they might face. Then we also want to address job security post-community service, as we've seen in the news quite a lot lately, and as well the potential salary cuts that are being discussed in government. And then I think also just a sense of belonging for junior doctors. We want JUDASA to be a welcoming committee for our doctors. I think for me, end of last year when we were struggling with our placements, the biggest thing was feeling a bit lonely at times and feeling like junior doctors are not always cared for. So we want to prevent that and create a sense of belonging for all our doctors. And then some other future plans is we have the dream of having a junior doctors conference. There's a lot of conferences happening in the medical field in South Africa, but I think we need some conferences that focus specifically on junior doctors and the cases they face and the problems they might encounter. A dream I have is a junior doctors mentor program where we can put junior doctors in contact with potential mentors to help them on their career paths. And then also some social events so that we're not just focusing on our work, but also creating social environments for junior doctors to flourish. So then after this talk, what is next? We want to start by saying that JUDASA is for all junior doctors. This range from students to second years post-community service. And our first step will be, as I mentioned, to build the structure and firm foundation. We want to start engagement with the Department of Health and ICSB for the mid-year placements for interns and community service doctors. And we also want to engage with the Department of Health on post-community service job security. As I mentioned, we also want to address any issues faced during training, as well as problems faced with HPCSA. But then here we want to do a call on you, and this is what you can do to become involved with JUDASA. After this, during the end of this week or next week, we will be sending out a survey in all the provinces where you can bring to our attention specific problems that you are facing. So please have a look out on all our social media pages for those surveys. And then all the provincial reps will then also be communicating with you. So please also keep a lookout on our social media pages for all our WhatsApp groups that we will be having. So please get in contact with us, raise any issues you are facing, and let JUDASA work for you. Thank you very much.
Thank you very much, Dr. Botha. Thank you very, very much. And then we will then take, I think we will take the company secretary.
Thank you, and good evening to everyone. So I really don't know what I could say more than what has been said by all of the doctors on this call tonight, and the very great enthusiasm we're hearing from Dr. Botha. I think just to reiterate, as he has said, JUDASA may have leadership, JUDASA may have a committee, but ultimately every single junior doctor that is a SAMA member is a member of JUDASA. It is of utmost importance to the board and to the organization that the doctors on the ground, the junior doctors specifically, have representation and are able to bring their concerns through the different channels to the committee. This is possible. This is the national structure. So if I can maybe say that, there's not just JUDASA. So I think if we can just clarify that JUDASA is one of the many committees we have that represent different doctor structures or through your career. We're busy formulating a student structure. We've got the SARA structure, which Dr. Klali has touched on, and that represents our registrars. We have our employed doctors. And the idea is that it's important that we hear from our members. So in the junior doctor space, as you've heard from Dr. Botha, this is where the advocacy, this is where the problems of our junior doctors are brought to a national level, but are also dealt with by the representatives as at a provincial level to make sure that we can attend to the needs of our members. They are your representation, but you, the junior doctors of South Africa, are JUDASA, and you are the heartbeat that brings it to us. We need to also please just say, if at any time you're unable to reach your reps, you're unable to reach through the structures of JUDASA, head office is here to support. We fully understand that the people that volunteer into these positions, volunteer into the committees to be that national representation, have full-time jobs. You're all aware of what it is like to be working in ComServe and intern and starting your career. And if you're unable to reach the committee members, we do please implore you to always reach out to the governance office at SAMA head office, and we will make sure that the chairperson and the committee gets your information, alternatively the professional affairs department. Again, I can't add anything or say any more than what Dr. Botha has presented tonight. They've captured the heart of what the JUDASA structure is and what the board and SAMA intends to do to support junior doctors through their career progression as junior doctors.
Thank you very, very much, Company Secretary. I think it is worth indicating that JUDASA is, in fact, the future of SAMA. Most of the leadership, especially in the current board, have started their career with the Medical Association at the JUDASA level. So it's very, very important that we build that pipeline of leadership to be able to lead the profession into the future. At this moment, we will then take Q&As, the Q&A session, which is you can then use the Q&A at the bottom of your screens to be able to ask questions, if any. So we will be taking those now. That is the time for that now. I don't know if we've got some questions there, Renee.
There are 2 questions at the moment, Dr. Norikido.
Can I take those? So the one is coming from Dr. Singh. Is asking if, good evening, is there any aid for foreign medical graduates in regards to board exams and placement? Yeah, so Dr. Singh, yes, we will answer that. I think it might be taken by Dr. Hussein. I think I know he's done some work on that. And then just a minute, Dr. Hussein. And then there's okay, so the other one is not a question. Okay, that's fine. So Dr. Hussein, if you can go ahead and answer the first question. Thanks.
Thank you very much, the program director and CEO, Dr. Norikido. Yes, as board exams going on every 2 to 3 months, we had 2 exams already last year and the beginning of this year. As the foreign qualified qualify and they get registration by the Health Professional Council, same time they get their placement. So they are placed in 1st of January. There are a lot of foreign qualified did get placement with our local graduate. And as the second batch result came February, they have been placed in March as well. And we are waiting for now intake for 1st of April and 1st of July, new placement will be coming. So as far as the aid and help for foreign qualified doctors, there are planning going on that they must attend some of those skill lab in different medical school through the dean, but I haven't seen the final outcome of that, but our program is in progress. Thank you, Chair.
Thank you, Dr. Hussein. I think we'll take the other question. How from Daniel Benjamin, I think Lamley is also trying to answer that. Okay, that has been answered. How does one get involved? And then we've got from Dr. Mintz, or on the matter of mental health for junior doctors, what are the interventions options available? Can we take that? I think, Tsepile, do you want to take that? Or who will take that?
I can take it,
Okay.
Honorable CEO. So with regards to the mental health support, we have had numerous ideas in the past. Some of them are more costly than others, but it goes as something as simple as having a support group amongst doctors, and more specifically junior doctors, where we can just sit down and debrief and talk about the challenges that we face on a daily basis. So that could be something that's quite informal, or it can go as far as also being an event, such as I don't know, like a braai, just aimed at reducing reducing stress and relaxation, resting and relaxing. Sam has also been quite heavily involved with the Healthcare Workers Care Network, which offers free therapy for healthcare workers who might be in need of urgent therapy or any form of therapy, even if it's not related to their work. So through the association, there are many things that can be done, and a lot of them can be done through especially the branch councils. And those are usually if there are events that need funding, etc. And then as junior doctors, you also have a lot of fresh ideas. So you're welcome to also share any ideas that you have with the current committee. And if willing, from the committee, you can also spearhead them to further create mental health awareness. I hope I've answered your question. Thank you.
Yeah, no, thanks, Dr. Tali. I think that's fine. So the other thing that the association wants to do in this year is also to just make sure that there are mentorship programs in place for all junior doctors, including the students. So I'm also happy to say that the next question from Dr. Stolle there, that all the doctors who are unemployed, we've sent out a survey. And if you have not filled that survey, because we will be making an announcement soon as summer in that regard, please contact our professional affairs department as well. You can look for Dr. Ziyanda there. We've got a list which we'll be happy to add your name if it's not on the list. So professional affairs is handling that. Yeah. So any other question there, Renee? Renee, do we have any other question?
Dr. Nori, we don't have any additional questions. There's nothing else.
Okay. So, but members are still allowed to post their questions there. If and when there's, yeah. So there is an email for Zianda as well. But if you call Sama and ask for professional affairs, you will in fact also get directly to Zianda at professional affairs. Okay. So if there's no other questions there, yes, the meeting is in fact recording. Yes, it is recording and it will be made available. Yeah, so that was another question there. Okay, so I think we can then maybe safely hand over if there's no other question but you can continue posting them. We will deal with them as and when they appear there. So maybe let's hand over then to Dr. Akhtar Hussain to do the closing remarks. And we're really looking forward to revive this important structure of the association, because we do believe that this is the pipeline for the leadership of the profession and the industry in general in our country. So thank you very much for having made the time. I will hand over to you, Dr. Hussain, to close.
Thank you very much, CEO. Thank you, colleagues. We appreciate your participation. As we come to an end of this engagement, I am motivated by the fervor and dedication exhibited by each participant in this discussion. It is evident that there is a common resolve to promote junior doctors' rights and welfare and bring about constructive changes in our healthcare system. Let us use JUDASA to give junior doctors a bigger voice, speak out for their needs, and collaborate on finding solutions, whether it is through grassroots level effort or policy formulation or advocacy routes. We are grateful to our speaker for their outstanding commitments to these crucial topics. Good night. Thank you very much.
Thank you very much, Dr. Hussain, and thank you very much, colleagues. Have a good night. We've come to the end of the webinar. Thanks.
Thank you. Thank you. Good night.